You get out of bed in the morning and your body sounds like a bowl of cereal. Your knees crack as you stand. Your fingers are stiff and slow to open. Your back pops as you straighten up. Your ankles click with the first few steps. By mid-morning, things usually loosen up. The stiffness fades. The cracking reduces. And because it improves, most people assume it is harmless. Most doctors agree. That is just gas bubbles in the joint fluid. That is completely normal, nothing to worry about. And for some people, that answer is correct. But for a significant proportion of people experiencing morning joint cracking accompanied by stiffness, that answer is incomplete. Because there is a difference, a clinically important difference, between a joint that pops once and feels fine afterward, and a joint that is stiff, painful, slow to move, and takes 30 minutes or more to feel normal every single morning. That second pattern is not just gas bubbles. That second pattern is your joints telling you something about what is happening inside them. Drop a comment. How long has this been happening? And does your stiffness improve within minutes or take longer than 30 minutes? That distinction matters, and I will explain exactly why. Let us begin. The first thing I want you to understand is the distinction between three completely different types of joint cracking, because the cause and the concern level is completely different for each. Type 1, cavitation, is the harmless gas bubble pop. Joint fluid contains dissolved gases. When a joint is stretched beyond its normal range, the pressure drops, and a gas bubble forms and collapses in the fluid, producing a pop. This is painless, produces no stiffness, and requires no treatment. Type 2, tendon snapping, occurs when a tight tendon slides over a bony prominence and snaps back into place. This often produces a clicking or snapping sound that can be reproduced consistently, in the same position, every time. Usually harmless, but can indicate tendon tightness or muscular imbalance. Type 3, articular surface irregularity, is the one that concerns me. This occurs when the cartilage surfaces of a joint have become irregular, degraded, or when the synovial fluid that lubricates the joint has changed in composition due to inflammation, nutritional deficiency, or early arthritic change. This type is accompanied by stiffness that takes more than 30 minutes to resolve, aching rather than painless popping, swelling around the joint, and progressive worsening over months or years. If your cracking fits type 3, the rest of this video is specifically for you. I want to tell you about a patient, a 66-year-old man, active, healthy weight, who had been experiencing morning joint stiffness and cracking in his hands, knees, and lower back for over a year. His joints loosened after about 45 minutes each morning, but the stiffness was worsening, taking longer each month to resolve. He had been told his x-rays showed mild wear, that this was age-appropriate, and that there was little to be done beyond pain relief as needed. When we went through his complete picture, his inflammatory markers, his gut health, his collagen nutrition, his vitamin D level, 3 specific addressable factors emerged. Within 12 weeks, he described his morning stiffness as reduced from 45 minutes to under 10 minutes. He told me, "I expected this to get worse every year. I did not expect to actually get better." He had not needed prescription medication. He had needed the right information. Cause number 1, inflammatory joint disease, is the most critical cause to identify early because it is the most treatable when caught before significant joint damage occurs. Inflammatory arthritis, including rheumatoid arthritis, psoriatic arthritis, and other autoimmune joint conditions, causes the immune system to attack the synovial membrane, the tissue lining the joint. This produces inflammatory fluid inside the joint. And it is this fluid, not gas bubbles, that creates the stiffness and discomfort that takes so long to resolve each morning. The inflammatory process is most active during periods of inactivity, which is why symptoms are always worst first thing in the morning, and improve with movement as blood flow increases and the inflammatory fluid is gradually dispersed. The key diagnostic indicator that distinguishes inflammatory arthritis from simple wear is the duration of morning stiffness. Inflammatory arthritis typically produces morning stiffness lasting 30 minutes or more. Osteoarthritis, mechanical joint wear, typically produces stiffness lasting less than 30 minutes. If your morning stiffness consistently lasts longer than 30 minutes and affects multiple joints symmetrically, please ask your doctor specifically for rheumatoid factor, anti-CCP antibody, and CRP testing. Early identification of inflammatory joint disease allows treatment to begin before joint damage accumulates, and early treatment produces dramatically better long-term outcomes than delayed treatment. Cause number 2, inadequate nutritional support for cartilage and collagen, is one that is almost never discussed in a standard joint consultation. And yet, it is directly relevant to joint health at a cellular level. Cartilage is primarily composed of collagen, a structural protein that forms the framework of the joint surface. Unlike most tissues, cartilage has no direct blood supply. It relies on the diffusion of nutrients through the synovial fluid, which means its nutritional supply is both limited and entirely dependent on the composition of that fluid. When the building blocks of collagen are deficient, cartilage repair, which occurs continuously at a low level, cannot keep pace with the normal daily wear on joint surfaces. The most critical nutrients for joint collagen maintenance are vitamin C, which is essential as a cofactor in collagen synthesis. Without adequate vitamin C, collagen production cannot proceed normally, regardless of how much protein is consumed. Glycine and proline, amino acids that form the structural backbone of collagen, found most abundantly in bone broth, skin-on chicken, and gelatin. Omega-3 fatty acids, which reduce the inflammatory environment in the joint and support synovial fluid quality. And vitamin D, which plays a direct role in cartilage cell function and calcium regulation in joint tissues. Vitamin D deficiency is found in a very significant proportion of adults over 55, and its connection to joint pain and stiffness is well supported in the research. Ask your doctor for a vitamin D blood test if you have not had one recently. A level below 50 nanomoles per liter warrants supplementation, and most adults over 55 benefit from 800 to 2,000 IU daily. Cause number 3, the gut-joint connection, is one that surprises almost every patient when I first mention it. Your gut lining is a selective barrier, allowing nutrients to pass into the bloodstream while keeping bacteria, toxins, and undigested food particles out. When the gut lining becomes more permeable, a condition sometimes called intestinal permeability or leaky gut, particles that should remain inside the gut pass into the bloodstream. The immune system identifies these particles as foreign and launches an inflammatory response to deal with them. This systemic inflammation does not stay in the gut. It circulates, and in people with a genetic predisposition, it concentrates in the joints, driving or amplifying the inflammatory arthritic process we discussed as cause number 1. Research has increasingly established links between gut microbiome composition, gut permeability, and the development and severity of rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. This connection matters because it means that addressing gut health through diet, probiotic foods, and reduction of gut-irritating substances can have a direct, measurable effect on joint inflammation. Reducing refined sugar, processed foods, and alcohol, while adding fermented foods, prebiotic fiber, and omega-3 fatty acids, creates a gut environment less likely to generate the systemic inflammation that drives joint symptoms. Cause number 4, Chronic dehydration affecting synovial fluid is the simplest cause, and the one most consistently underestimated. Synovial fluid, the fluid inside your joints, is primarily water. It provides lubrication, reduces friction between cartilage surfaces, and delivers nutrients to cartilage tissue. When you are chronically mildly dehydrated, synovial fluid becomes less abundant, and its lubricating and cushioning properties are reduced. The result is increased friction between joint surfaces, more audible cracking, and increased stiffness, particularly after prolonged inactivity overnight. After the age of 55, as the thirst mechanism becomes less reliable, mild chronic dehydration is far more common than most people realize, and it is one of the simplest modifiable factors affecting joint comfort. The first glass of water in the morning, before coffee, before breakfast, begins the rehydration process that restores synovial fluid quality for the day ahead. Aim for consistent hydration through the afternoon, when synovial fluid quality is most influenced by cumulative daily intake. Here is your complete action plan starting today. If your morning stiffness lasts more than 30 minutes, ask your doctor for rheumatoid factor, anti-CCP, and CRP testing. Ask for a vitamin D blood test. Begin consistent daily hydration. Start every morning with a full glass of water before anything else. Add omega-3 rich foods, bone broth, skin-on chicken, and fermented foods to your daily diet. Reduce refined sugar, processed foods, and alcohol to lower gut-driven inflammation. And begin gentle morning movement, 5 minutes of slow joint mobilization before getting out of bed to stimulate synovial fluid distribution before standing. Your joints are not just wearing out. They are responding to specific addressable factors, and now you have the information to address them. Share this with someone whose joints crack every morning and has been told it is just their age. Drop a comment. Which joints are most affected, and how long your stiffness takes to resolve each morning. This is not about age. This is about information. Take care of yourself.